if you say, so what's our organization's strengths? And their first reaction is, well, we do a really good job, getting press releases out on time. And it's like, okay, that's good, but I think we got to go up a level, that's at a tactical operational level that maybe is.
Hi, and welcome back to another episode of the Leadership Cafe podcast. I'm really excited about today's conversation, and I know I say that every time, but this one is not to be missed. We are here today with Michael Marchand. He's a principal at the Marchand Group and helps public and private sector organizations address social, community, and organizational needs with kind of an eye toward creating and redesigning business engagement. He helps clients address policy and strategy at the local, state, and federal level, which is really vital in these days. And he has a proven track record of increasing performance for Fortune 100, nonprofits, community organizations, early stage companies, government, and issue-related causes, which I love about Michael's experience. We know each other because we worked collaboratively in the healthcare space in Washington State when he was previously with the Office of the Insurance Commissioner and the Health Benefit Exchange in Washington. And we have that healthcare experience alignment together. And so today we are going to dive into the deep end of healthcare and some practical tools that you can implement to address some of the strategic needs in marketing communications, but in overall strategic leadership in healthcare. So, Michael, thanks for being here with us. We're excited to have you.
Yeah, thanks for having me, Sally. When you read that, I become both overwhelmed and then realize, wow, we've been at this a really long time.
Yes. Yes, we have. And, we worked together to help roll out the Affordable Care Act in Washington State. And I think it's just been such a expanding experience to address, to your bio of the local, regional, and federal levels. It's not as simple as just, we're going to do this in our market. It's pulling on all those strings. And I feel a little bit like we're back in that space again today.
Yeah, I definitely feel that too. It feels that healthcare continues to evolve and evolution comes in many spaces. It can be a policy space, it can be a technology space, it can be an organizational space. And everyone's facing those challenges who's in that healthcare landscape right now trying to play in the water. It's just, that's where we are.
Right. So before we get too deep in there, I want to have you just tell our listeners a little bit about your path and the things that you're focusing on at Marchand Group.
Yeah. So, again, introduction, I think pretty much table set is as well as I could say anything, at the Marchand Group, we're focused on a lot of healthcare policy right now, nonprofit strategy, insurance and regulatory advocacy, and working with organizations who are trying to navigate change right now. And it's change for a multitude of audiences. I wish I could say there's a specific piece of change, but change is both internal and external for organizations right now, especially in the healthcare space. And yes, I arrived here I was previously deputy commissioner at OIC and worked to build the exchange back in the day, spent over a decade there starting that up. And then I've had, I'm probably one of the few people you'll meet that I've done .com startup. I was director of public affairs for HHS for the rollout of Medicare prescription drug coverage. Worked there for 4 years, worked for Microsoft on their enterprise and consumer health solutions. And so I've kind of seen it all. And I feel really fortunate. I don't know, change gets me excited. So I feel kind of fortunate to be at this time and place where we are, but I also understand the concerns and the hard thinking that has to come to our leaders in our organizations, whether they're public or private, to know what the future is going to hold.
Right. And I think to that point, when we're talking about healthcare or nonprofit, really any business, I chuckled when you said, I deal with organizations who are facing change. I'm like, well, that's pretty much all of us.
We're all there.
Whether you're a small business or a giant conglomerate health insurance, there is a lot going on. And I feel like the thing that, between Medicaid cuts and ACA subsidies going away, that, funding, the challenges of all the geopolitical things going on, we are on top of an already stressed workforce in healthcare. And at the same time, we're seeing the distrust among patients and
Oh, yeah.
consumers growing. Part of that fed by the rhetoric of the day as well. Obviously, this landscape is challenging, and that's Captain Obvious here.
Yes.
But
Yeah, I was gonna say I was fortunate enough to attend a conference last Friday of the healthcare communicators Northwest in
Mhm.
Vancouver, Washington. I happen to be on the board there, but we received a presentation from Edelman, who had
No
the
good.
big
Yeah.
PR who with their trust barometer
Yes.
specific to healthcare. And what
Mhm.
you just said was painfully true. Is that
Mhm.
we've got some serious trust issues that are pertinent in our customer base that with what would be historically trusted and valued messengers of healthcare information,
Mhm.
and it's not that case
Right.
anymore. And so
No.
it's how do you, in an evolving world where people are getting information from different places and different channels,
Mhm.
and the
Mhm.
messengers are very different, and
Right.
how are you gonna balance that? How's that all gonna work for you?
Right. It's interesting you bring up that report because I love the trust barometer. I watched it for decades. There's also a report, Monogle has a humanizing healthcare report that they've done every year for 9 years now. And have just gone to a quarterly release because the needs of healthcare consumers are changing so quickly. And they released last week their quarterly release for Q4 25. And trust is the biggest thing identified there, particularly among the younger patient
Right.
generations, the
Definitely.
Gen Z, millennials. And it's been interesting. We were talking with some rural health leaders earlier in the week, and, they want to launch a new mission and vision and new communications out into the atmosphere. And as we read through these things, there has never been a more important time in my mind and in my experience for communication strategy and communication implementation. What are you seeing or hearing in your conversations?
Yeah, so that's very
Mm.
true. And the other thing that I'm seeing that I think is fascinating is organizations maybe, who historically haven't done the homework to maybe separate out as you focus very on, let's say, younger, let's say
Mhm.
individuals under the age of a 20, 25, 26, or the 18 to
Mhm.
34. What I'm seeing is organizations all of a sudden going, okay, here are our messages, and I'll say, great, for which audience are these messages for? And they'll just say,
Right.
no, these are our message. This is what we
Yeah.
do. And I'm thinking, okay, I think there's different messages now where you're going to have to, as you said, you're going to have to lean into where are the people that you're speaking to, what channels are they using, and
Correct.
are the message, you just can't have, here are our 5 messages and hope that it works across internal partners, external partners,
Correct.
legislators, consumers, everything.
Mhm.
It doesn't work that way anymore. So it's not even that the
So true.
messages have changed, also the delivery channels have changed. So the
Yes.
person who's opening the email may not be the person you're gonna get on Instagram, or if that's what you
Right.
choose to use, depending. And again, and then the final thing I would say is I am continue to be shocked at how little data organizations have on how people they're connecting with people. Like, just
Right.
what actually is working? Do you have open rates? Do you have views? Do
Mhm.
you have any idea? Do you follow back up with people to get survey data or something that would help you quantify whether or not you're getting to the right people and whether or not they're even understanding the messages? And it just blows me away because data is power. I mean,
Yes.
information is power. If ChatGPT and AI has taught us anything, is information is the most powerful currency in the world. And
Right.
so you really got to use that to your advantage.
Right. And then you add in the complexity of not only the age differentials, the cultural differentials,
Cultural,
and you
income,
are
everything.
yes.
Everything.
location. I mean, what
Right.
works for a rural
Geographic.
audience is
Right.
gonna be different for
Right.
downtown Seattle or the Microsoft crowd in my so it's such a powerful thing, and you and I presented with a colleague recently to the Washington State Hospital Association around creating actionable change for rural hospitals, rural health, and really in that conversation we touched on this how vital to implementation of change that communications on health literacy is, and you brushed on that just a little, but I'd love for you, because I see it in your posts, I see it in our
Right.
conversations we talk a lot about, summarize kind of your thinking around communication in these times of change, maybe the literacy aspect and really strategy, and then we're gonna dive a little bit more practically into that as well.
Yeah. So as healthcare has gotten more complex, the
Mhm.
need to explain the complexity has just added that much more of a, I would say, even a barrier to consumer understanding of what they're facing. And that could be
Right.
in how it could be on a financial level, how they're paying a bill. It could be how they're
Mhm.
buying their insurance. It could be even understanding what services they're trying to seek. And the
Correct.
struggle we're having right now is that there are a number of antiquated approaches that I would say the system has memorialized and embraced, even to the point of from a legal aspect, that are now no longer helping best serve particularly
Mhm.
consumers. And
Right.
so part of what I've been trying to work with some companies on is how can we make look the at the end of the day, you don't want your call center just continue every time you send out a letter or a notification, which by law you may have to, and it's
Mhm.
convoluted. And maybe
Mhm.
it doesn't like hit the mark totally. Even if it says you don't have to do anything, people are still going to call your call service
Yep.
representatives and ask you, I got this letter that tells me I have to do nothing. What should I do?
Yes.
So
100%. I
mm,
ran a call center
yeah,
for a health insurer,
exactly.
and every time a notice went out, they would be like, "What?
Yep,
Who
and you gotta
sent a
brace
letter and
for it,
where?"
right, and so
Yes.
how can we streamline some of the language, and how can we get better about how we position things, and maybe even
Right.
take a look from a legal framework of what are we actually requiring in our notifications, and is that helpful?
Right.
Because
Right.
there are a lot of standing legal requirements in
Mhm.
notifications, and
Yeah.
and no one likes getting a 10-page letter that really the first paragraph is the only thing they needed to pay attention to, but
Yeah.
everything else is legally required, and
Yes.
it just
Yes.
becomes very confusing for people.
Well, and it's immensely expensive, which just adds to the compounding problem.
Right.
When I was at that health insurance company, Medicaid, we had to legally get a provider packet out to a member within a certain amount of time. And about 40% of them got returned undeliverable. And so it was just this cycle of we would have to then call, see if they had a different address, resend a new packet. And it's interesting that you talked about the confusion. And I think when we get in healthcare, especially, I feel like we have so much knowledge that what feels like common is
Right.
not to the audience. And that's the problem that physicians aren't your target. The administrators aren't your target. We did research at that Medicaid health insurance and discovered the most misunderstood term across the board was deductible,
Right.
which you have for
Yeah,
health,
you have a
for
car,
car insurance, for
home.
home insurance. We totally expected it to be co-insurance or any of these other things, but deductible, which was dumbfounding to us because we were trying to solve at these other layers, but when we looked at the audience, it's like, "Oh, they don't even get step 1."
Right.
So
So
we had to really change our approach to communications.
So I would say, I have 3 kids, and over a course of time, of course, you're going to pediatricians' offices, you're going to various things. I
Mhm.
would say, and in literally half of the instances I took my kids to the doctor, I overheard a conversation at the desk where someone was asked to provide a copay, and that person saying, "Why am I paying? I have insurance." Like,
Mhm.
the whole
100%, I've
the
heard that
whole
myself.
concept of copay is lost on people because
Yes.
they don't understand. To your point about their
Right.
insurance, that's not necessarily how things work. The other thing that I
Right.
begin to realize too is that, and you're spot on about letters. I mean, especially with a population like Medicaid, where you've really got to understand the population well. But I will tell you this is reaching people with pieces of mail is probably not in your best interest.
Mm-mm.
It legally you're required to send it,
Mhm.
but
Mhm.
I don't think, I think this is where I think the healthcare system could really improve if they thought innovatively of how do we
Yep.
create intervention to help people understand their coverage and what healthcare is for them based on what if it's a commercial or non-commercial product.
Yeah.
And it's not in a 10-page letter.
Right. Well, even just I think we spent $800,000 a month on member packets, and we wonder why it's so expensive. It's like, that's just ridiculous. But
Yeah, that is
so I wanted a couple of weeks ago, you shared a post on your LinkedIn profile, which we'll link his profile to the show notes. Because if you're in healthcare, you want to follow Michael Marchand's thinking and insights around healthcare and where we're at. You shared this post about some SWOT analysis work that you did, and then you also, charted out some ideas of out of the box ways that we need to begin to consider in healthcare, certainly in rural health. I want to touch on that idea of a SWOT because you hear it all the time. It's that one page 4 boxes, strength, weakness, opportunity, threats, which has a little bit of an outdated brand
totally.
recognition to me. I think it needs to be rebranded. Maybe you and I should come up with a
Yeah,
new
there
name
you
and
go.
rebrand the SWAT but it's such a helpful tool. And I want you to talk a little bit about what can it help you do and why is it important in times like these?
Right. So I think the most important thing that any organization can do when they start out is, and I do this with clients, is can we get agreement on what success looks like? I
Yes.
think that is a critical question. And if there's agreement on that, and if it marries up to your mission vision, that's also super important. And then what I like to do is go next to the SWOT. And because that gets people thinking about it's kind of thinking really hard about what does our
Mhm.
organization do well, what don't we do so well, and where
Mhm.
may there be opportunities for us to do more things, and mind you, it maybe where's the opportunity to stop doing some stuff, and
Mhm.
then
Yes.
where are the threats in that. So here's the thing, and I use this line when describing it to clients all the time because they'll hear the word SWAT and they're just going, oh boy, it sounds like
Yeah.
I'm going back in time. But what I would say
Yes.
is SWAT isn't a worksheet, it's a strategic mirror. I'm holding a mirror
Yes.
up to you
So good.
and you're looking into it and telling me what kind of organization you have and you're
Yeah.
gonna wanna have. It's all about
Right.
building toward the future. And it really
Mhm.
a SWOT analysis forces honesty. It reveals, like, where you need to go, where leverage points are. It aligns all your internal and external capacity, against a backdrop of maybe a lot of external dynamics or factors that need to be considered, and it also
Mhm.
will start to reveal dependencies you may have among
Sure.
your programs, among your resources, among your funding. And I find it to be super, super helpful. I know you're spot on. It very much sounds antiquated, but it is really the first step in strategically thinking about your business.
Sure. So who's the right people that should be involved in that
Right.
or when? I mean, I worked for a lot of organizations that did a SWAT back in the day.
Right.
And then they don't redo it when we're updating a strategic plan or
Yeah.
when we're looking at a new budget or whatever. But the pressures of today's reality, I believe, if you haven't updated your SWOT or strategically reflected on who you are, who you need to be, and what's between here and there, that I feel like it's the line in the sand that tells you what's next. So who should be in that, and
I
how do they
no,
get started?
I think it's a leadership team level exercise.
Okay.
What I would maybe say is, and it may depend on your leadership team, depending on
Sure.
it, so because there's some leadership teams that depending on the size, it may be good
Right.
to bring, I'm a big fan of after a certain number of people, sometimes consensus building and discussions that distort become counterproductive because
Mhm.
there's just too much. You don't wanna spend 3 days working on something all the time.
Right.
So what I would say is if you're a leader, if I'm a leader, I'm thinking to myself, "Who do I wanna get in the room to do this? Can I get
Mhm.
everyone? And if not, is it more helpful for me to just get a couple of people in the room that we build out something that a group can react to?" And
Sure.
that way you kind of head down the path of, "We've started this exercise.
Mhm.
Here's where we are. What do you think needs to be modified or is missing or needs to be added?" Whatever it is. So
Sure.
as for timing, I think you hit the nail on the head. I would always say if you've got a report, you've got a file that's like annual reports or, legislative, if you're like in public sector and you have a legislative
Mhm.
update or whatever you have to do and it's annual, is to pin it to that. Because here's the thing that people don't understand. The more frequently you do it, the easier it is to complete because you're not
Sure.
looking back. It's not like you're making wholesale change. Where organizations run into problems is that they haven't done this work, let's say for 5, 7, 9 years. And now all of a sudden it's, wow, we've never taken a hard look at our mission. Like, are we, or they're saying, or the mission vision is saying one thing, but the activity is no longer
Mhm.
aligned.
Mhm.
And it's like,
Right.
whoa, wait a minute. Are we getting out into uncharted water?
Sure.
And,
Sure.
another good time to do this is, I know a lot of organizations who go through, let's say if you're going through brand change or something like other
Mhm.
major changes in the organization, where it's, okay,
Mhm.
this is a golden opportunity for us to reevaluate.
Right.
Golden
Right.
opportunity, because if we're gonna be making all these changes and the work that we're doing no longer isn't necessarily aligned or reflected that way, whether it's mission, vision, brand,
Mhm.
and especially in today's world where activities are changing so dramatically.
Yeah.
And,
Yeah.
they're hard conversations. They're hard
Right.
conversations because I would say getting alignment around strengths is never usually the issue. Around weaknesses, that's where people, and opportunities, that's where people sometimes get squeamish because people may see, I think our funding is a weakness, whereas, and people might say, well, I don't actually think that's the biggest weakness. And so it's
Mhm.
trying to carve out what that looks like for everyone.
Sure. Sure. It's a good point, and I love the idea of maybe getting a couple people to start because I have found editing is beats that, "Okay, what are our strengths?" The crickets around
Well,
the
no one
room, like,
likes slying.
everyone averting their eyes.
I have never been to a leadership meeting and had a positive experience where people start off by staring at a blank sheet of paper. That is
Yes.
that is always a disaster because no
Yeah.
one no one knows where to start or people have varying places they want to start. The other thing is
Mhm.
too is and this is where it helps consulting with the CEO or people ahead of time is you're going to have people in your organization who are strategic by nature, so this conversation may flow to them much quicker than
Mhm.
others that maybe are more tactical and operational in nature. And so,
Mhm.
if you say, "So what's our organization's strengths?" And their first reaction is, "Well, we do a really good job, getting press releases out on time." And it's like, okay, that's good, but I think we gotta go up a level, that's at a tactical operational level that maybe is to your point, you don't wanna be spending like 15, 20 minutes talking about things at that level. That's not the intent of the
Right.
conversation. So that's where reacting to something is helpful.
Right. That's so good. What is the so we all know we go through strength, weakness, opportunity, threats. And I honestly have used basically that approach for a lot of sub campaigns. Now, once we're going to expand into a new market, for marketing or communications, I could do a little sub SWOT on putting this service into that market. And so it helps me at a
Yeah, you're
smaller
mapping.
level too if
You're
I'm not
mapping
an
it.
executive.
Right,
Yes.
you're mapping what you're doing. Because without it, you're
Right.
guessing.
Right. Right.
And no one likes guessing. There's that it's a the lack of a SWOT, especially in a campaign setting of that type where what I like to do is say, Let's think of deliverable timeline, work backward."
Right.
So when you're building Gantt charts, if you don't have that SWOT kind of done, you
Right.
don't know if you don't have enough clarity around if you're doing the right thing or not. When you
Right.
have a SWOT, you're actually mapping things, and that's actually helpful. So it really is the difference between, to your point, is SWOT is what will get you from the vision of what you want to accomplish to the actual execution.
Right. And even at that campaign level, if a listener were applying that, Michael's advice to start with, what does a win look like?
Exactly.
We can't just go into a campaign and say,
Exact
okay, I just threw stuff out there on a plan. A lot of people mistake a plan for strategy.
Right.
The strategy is going to say we need to get 100, patients on the books by X, or we need to increase access by 4%, or we need to whatever, increase admissions. And I feel like that part often gets missed in these kind of sub plans. And that's where starting with the win and then working backwards will help you be strategic, which ultimately I think positions communicators and marketing better in an organization because then you have something to prove. You got something to show for your work.
No, that's exactly it. I mean, a good s so if you first of all agree upon what success is, then you do your SWOT.
Mhm.
It helps you identify what that first win is. And the smallest
Right.
strategic move of first win, that small
Mhm.
move is often the first has the biggest ripple effect in how the what the success will be like moving forward.
Sure.
And I am a big fan of you'd be surprised. So I'm working with a client right now, big legislative issues, and they're thinking, "Oh my gosh, how are we gonna keep our organization afloat? How are we gonna make money? Like, we're seeing all these cuts, this is gonna be horrible." And it's like, what's the first win? And the first win sometimes is as simple as, "We need a meeting with the following people in the room, and we
Right.
need to come to agreement on here are our priorities, and here's the water that people are gonna carry out into the world to get us further down the road." And it's just like
Mhm.
getting that meeting on the calendar and done. That's, just that getting started. It's like, okay, we got that done. Now what's next? So it's thinking through that ability to just like start driving toward accomplishing something and then aligning it with what happens to come next is
Mhm.
like that first win is so critically important. And it doesn't have to be a
Mhm.
big thing. I think people get wrapped up with the idea of everything has to be solved really quickly, and it's not that way.
Right. Right.
That way.
We can't solve world peace with one
No,
one meeting.
no.
We've gotta.
But at least we can get the people in the room. You know as well as I do in healthcare, think of all the players. Sometimes it's really
Mhm.
hard to get everyone in the people you need
Mhm.
in the room. And I'm not saying they
Sure.
all have to agree. I'm just saying I need them in the room though. And then we can have a
Mhm.
conversation around whether what do we agree or disagree on.
Sure.
But and the other
Amazing.
thing is about this too is that it allows you to be nimble because if there's one thing that we know is that there are no such thing as like the static strategy doesn't usually hold very well. So, what may be working or you think will work today may not be what you want to do tomorrow, depending on what comes
Sure.
into your inbox or what gets passed, or whatever.
Sure.
But I think it's super important to have that idea of, we're opening the box to, can we build on this? What phase are we in? And starting with what's the most actionable.
Sure. That's so good. And it's super smart. So I had an interesting conversation. A member of our Leadership Cafe community said, "Hey, I have an idea for you." I'm like, "Okay." And so we got on a call and chatted, and she had been at a conference with a whole table of rural health folks, which is who we focus on, but I think it applies to all of healthcare. And she said, "I asked the table, what is the thing you want to know, or would want a session on or whatever?" And she said the answer was help to understand when what should be done in-house versus when we pull an outside entity to help us. And it may sound like a self-serving question from a consultant agency owner, but I've been on the other side of the table. So for this kind of work, SWOT, I have seen it go both ways internally. And I'm interested in your advice on when should you look at having an outside opinion help with these kinds of process changes?
That's a phenomenally awesome question. And that is what I would also say to that person is I would say congratulations, you're extremely self-aware
Yeah.
because I used to joke at a former, I would say, large private employer. We used to joke that we would want to go through some of these exercises with our leadership team and we would be saying the need for certain strategic movement or
Mm-hmm.
certain activities and related to the company
Mm-hmm.
that would be much more financially and operationally viable. And we wouldn't get heard, but if an outside consultant came in and said the
Mm-hmm.
would say the exact same thing and they took that word as gospel. Well,
Yes.
I think you have to read the room. So if you've
Yeah.
gotten to the point where you've maybe tried to run the exercises or helped run the exercises, if you're in a chief of staff position and you're working with your leadership team or CEO on trying to run these and it's just not getting as much traction as you had thought,
Mm-hmm.
you may want to have third party
Yeah.
validation come in. Just because,
Right.
and it's not to say you're not competent at it. It's just to
Right.
say it may not be the message, it may be the messenger in the sense that
Right.
people just there's a certain gravity that comes with when you're paying someone outside to give you information.
Right.
People
Right.
will sit up and they'll take that information with a lot more like a just they'll take it more seriously and because
Right.
they're paying for it. And
Sure.
and that just happen sometimes that just happens with leadership teams where the camaraderie and like they're tightly knit and they all know each other really well and it's just easier. The other thing is that I like bringing in someone from the outside in is because that way I know this used to happen to me when I was in organizations in the leadership team. I don't necessarily want to run a conversation that I want to be a part of because it's
Yeah.
very hard to facilitate and walk people through SWOT if you want
Right.
to add things to SWOT and not look like you're steering the
Yes.
discussion.
That's really good.
So that's when you I need to get someone in here who can run this program for me for a morning or a day
Yeah.
and I can walk a group of leadership through what's going to transpire, what the agenda will be,
Mm-hmm.
and have them meet with the overall facilitator and do it that way. But that way, I get out of the mix, and it doesn't look like, oh, Michael was just having us do this exercise because he's really interested in moving AI chatbots forward, and he had this alternative agenda. Like you get out of
Yeah.
that narrative because people will build that
Yes.
narrative in their head and,
Sure.
yeah, so that's the other reason is so for those 2 reasons of, people they'll listen to
Mm-hmm.
people from the outside and, you
Mm-hmm.
wanna be a willing participant yourself.
Sure.
That's why it's
B-
good kind of at that point, I would go look to a consultant to help you with it.
That's so smart. And truthfully, I have had McKinsey reps call me and say, "Hey, what do you think about this?"
Yeah.
The same thing I've been trying to say internal. We'd go to the next meeting with all the corporate execs and the McKinsey rep, and he'd present my ideas. I'd be like, "Well, I'll be darned."
Oh, no, that happens all the time. I mean, that happens, there are so many, even in technology where you have huge system integrators, whether it's McKinsey or
Mhm.
Deloitte or Anderson or whoever, and it's, they'll take the best pieces of the ideas that are provided by the client and package it up.
Mhm.
And sometimes,
Yeah.
again, it's the messenger. It's not to say that if it's not to say the idea was bad. It's just maybe
Right.
not being heard with the gravity it needs to be heard with.
So good. So good. Well, I love this conversation. I could geek out about strategy all day,
Oh,
but
yeah.
we don't have it. So, if folks want to connect with you, Michael, where should they find you? What's the best place to look for you?
Sure. Of course, LinkedIn. I'm always on LinkedIn. Feel free to message me on LinkedIn. Also, you can reach me at michael@marchandgroup.com or visit my website, www.marchandgroup.com. And yeah, I mean, I think we're living in a day and an age, especially in healthcare in particular, where there's just like a lot of strategic thinking that's going to be needed.
Mhm.
And it's also bringing in a lot of different
Mhm.
avenues to have conversations move. I'm a big fan of
Sure.
public-private partnerships, and I think
Mhm.
that is going to be mission critical as we start looking toward the future. Of course, there's a lot of the rural transformation grant and things we haven't even touched upon as far as rural health. There's a lot of money being put in there that states are weighing how they're going to either fund new innovative things or, bolster already new activities that they've undertaken as states. And what could that 5-year flight path of work look like for them to help them realize federal dollars? And then finally is, I think the affordability question of healthcare in general
Mhm.
is getting to, I almost feel like we're at a tipping point. I feel like
Yes.
some programs are at a tipping point. I feel like Medicaid as a program might be at a tipping point. I
Mhm.
feel like our insurance markets, certainly the individual market as a commercial product, is
Mhm.
almost at a tipping point where
Yeah.
I don't know if it's feasible to keep it running it's not functioning as well as it could, and I don't know if there's a real opportunity to invest more in it to make it work. I mean, it's gonna be
Yeah.
very interesting to see what happens.
Sure is. I really appreciate that. Thank you for being
Yeah,
here. And
yeah.
we're excited if you were here and listened and like what you heard. Follow us on Spotify or Apple Podcasts. And if you're interested, we have these kinds of conversations inside the Leadership Cafe all the time. It's for rural health and nonprofit folks. It's free. It's on a platform off of social because we don't want the bots and the drama. And we wanted to have a safe space. So
There you go.
find more information at theleadershipcafe.com. Thanks for coming.
Yep, thanks, Alex.